wait till this is a disaster, till this is out of control. When my mom started getting violent, like that was, we were so unprepared. And, instead of being quickly able to make a decision, it's really a struggle for like 15, 20 minutes to pick what you're going to get. And this is the same menu you've been looking at for years. It's like things that didn't strike you at the time that were like the idea that like she doesn't recognize me, I don't know how to react to that. I don't know how to, I'm learning how to deal with this. But having somebody who is a professional could just come in and be like, it's okay, and kind of calm her down and get her through stuff was a big deal. Yeah. And we got in touch with Aging Network Services. It has like a private, social worker kind of thing when stuff was really starting to get bad. And they definitely steered us toward MCM.
A nurse practitioner using it as our primary care. And she comes and sees us once a month. She keeps on me to get things done. And has enlisted a Dan to help. She takes care of Ann. She checks Ann over. The hospital obviously doesn't have round-the-clock help. Obviously there's nurses there all the time, but they're not with the patient all the time. And that's when we had healthcare aides coming in, both in the hospital and in the nursing home. They would come in for overnight.
Unique situation in that you're an adult helping with care for your adult parents.
Yeah.
So that's a unique situation that maybe there are some people out there who are doing the same thing. And so you need help with that. Yeah. And so you sought the help.
They showed him respect and love after they got to know him before talking.
With my mom and really take care of her. They also work with other caregivers and have really make sure that she is not only well taken care of, but that there's always coverage if someone's out. And we've been very, very satisfied and are so appreciative of Steve and Andrea for everything that has happened. I also wanted to thank the staff that works on scheduling, because there have been moments where we've needed caregivers and we haven't had them, and I've called and everyone's been extremely well responsive and helped us in every step of the way. So thank you so much.
Whether it's the weekend, whether it's later, if I text and send it, hey, we got this problem, we got that problem, you all get back to me. You're always there, which is, I don't know how to say how valuable that is. It's like you're always available if something is going wrong.
Okay. Well, my name is Stan Marmerstein. It's my wife Ann that MCM is providing home health aides for. So I have been doing it for, I think, since 2019. Okay, in 2019, they supplied home health aides at a nursing home where Ann was in for about a year, and then she was discharged from the nursing home in the beginning of 2020, just before the COVID pandemic started. But that wasn't the reason she was discharged. It just happened to work out that way. And so since 2020, we've had home health aides here from MCM. The first one was Rowena. She was a unicorn, as she was described, because she would come in the morning, then take Ann to the daycare, adult daycare, and then come back in the evening. 12:30 at night, it's called actually morning, I guess at that point. Dr. Fuss said, well, we're going to admit Ann, overnight, and I could go home. And Fatima was waiting for me.
Both of my parents had dementia, and we started using MCM about 9 years ago. And we started very slow with just an aide a couple times a week, and then it kept increasing as the needs were increasing. And we had multiple times when we needed overnight sitters, we needed people in the hospital, and MCM always came through. Their caregivers were absolutely wonderful. We just really connected with all of them and had a really good experience. And Steve and his whole staff are amazing to work with. And we couldn't recommend them more. We are just so pleased. And unfortunately, both of my parents have passed, but I highly recommend MCM for all of your needs for elderly parents. Thank you.
Multiple caregivers through medical consulting and management to help us with my mom's care after my father passed away. And the caregivers have been stellar. And we have really enjoyed working with Charlene and with Precious, and feel very fortunate that we've been able to not only build relationships with them, but that they've also built a relationship with my mom and really take care of her. They also work with other caregivers and have really make sure that she is not only well taken care of, but that there's always coverage if someone's out. And we've been very, very satisfied and are so appreciative of Steve and Andrea for everything that.
Having people to call on to help us, like we weren't alone. Like it wasn't like we're fighting this battle by ourselves.
But having this nurse from medical consultant has been like my mother giving birth to my sister, although she takes better care and is more loving than my sister. I truly love her from the bottom of my heart, and so did my husband. And in all honesty, I could not picture my life with it, and their service was a lifesaver for me. I was never without someone. I was never alone. They took and loved my husband. All of the people were more than qualified, and everyone that helped my husband, I would recommend individually. That's how competent they were. Married, totally and completely attached. So having someone take care of him was difficult for me. I never left the house in 10 years. One was always caring for me, even though I needed no help. But he didn't like when I went up the stairs. He watched to make sure I didn't trip or fall. At the funeral, he was with me in the limo. I can't tell you I loved every single one like I do Esther, but close to it. And when I lost my husband, they came to the funeral cemetery.
Don't wait till this is a disaster, till this is out of control.